best clinicians in a rural environment are much like a Swiss Army knife. You know, a Swiss Army knife is not going to be the ideal knife in certain situations, but having the ability to get by and get people through, and it's certainly the knife that you're going to want if you're in, you know, a camping situation where there could be a variety of different challenges that you face at any time.
Rural physicians are the keystones of their community's health care, and they take great pride in the range of care that they deliver. The problem is there are too few of them, and that shortage is only going to get worse. An article in the New England Journal of Medicine predicts that by 2030, the number of practicing rural physicians will fall by almost a quarter. That's why Dr. Brian Hodge and others at the Mountain Area Health Education Center in North Carolina are coming up with solutions. Hodge leads its Rural Health Initiative.
We're really taking a comprehensive approach, so our ideal situation would be to take someone from their hometown to actually nurture them and encourage them with early pipeline programs at the high school level, at the college level, at the graduate level, to really make the most of who they can become and get them plugged into a health career. So as an example, we have a program that's called Project Promise that identifies rising potential health leaders at the high school level, and we give them shadowing experiences with graduates from our program in rural areas. We also will teach science-based dissection labs and ultrasound in the high schools to really light that fire for those potential future leaders.
Once those high school kids are hooked, they're helped along the path to medical school. Dr. Jeff Heck is the CEO of MedPage, a group committed to improving healthcare for rural western North Carolina.
We're working very hard to make sure that more rural kids get into medical school and pharmacy school, etc. And then we're trying to provide, we have special programs at the University of North Carolina where we are focusing really heavily on making sure that those kids who are going to go into rural practice get a lot of special attention. They have summer experiences out in rural communities. They train out in places like in Asheville in western North Carolina to keep them connected to rural areas. What we want once we get a rural kid in medical school, we want to make sure that they don't get too attached to $5 coffee and sushi. We want them to continue to enjoy the things that rural areas have to offer that the urban areas don't.
These recruitment programs also focus on excellence in medical residency and teaching opportunities in rural areas.
So we try to get every single resident out in a rural community as part of their training. We are very attentive to try to recruit faculty from rural areas and do faculty development so rural physicians become as astute and as excellent of teachers, if not better, than what we have in our major medical centers.
Dr. Patricia Hall completed a rural medicine residency, and she now practices at the Mountain Community Health Partnership's Silo Health Center.
Having faculty who believe in the service we are providing, who have experiences in other rural underserved areas, and who can prepare you for that extra layer of challenge of not just knowing the medicine and the next step, but how to work through with the patient on achieving the best next step together. And I would say even the next layer of the emotional challenges of that, working hand in hand with patients who do have socioeconomic challenges.
Hajin Haq also use their experiences in rural training to hold the interests of future rural doctors.
I was especially drawn to working in underserved and global environments, and so I went to medical school in Missouri, in Kirksville, Missouri, where that was my home state, and then I did my residency program in family medicine out in Colorado. And I received really good, well-rounded training out there from a community-based hospital. The heart of really why I wanted to go into medicine in the first place was to be able to make a difference and provide services that aren't available. And even though I was kind of inspired by these like a lot of global health experiences, I really figured out pretty quickly that there's just as much need in our backyard.
I went to medical school in the late 1970s, and during that time, the the American Academy of Family Physicians was only about 10 years old, and there was a very strong movement throughout a lot of the medical schools that there needed to be more training in primary care, particularly family medicine, so that it could meet the needs of rural America. And for those of us who were motivated by mission and motivated to help serve our communities, a lot of us went to trained in family medicine and then went out into rural areas to practice.
My clinic in Silo Health Center is right on the river. I get done working and my husband's outside fishing, and we love being there. So I think if living in a beautiful rural place brings you joy and helps you be a better, more fulfilled practitioner, I would encourage people to strive for that.